So it's the grand finale of the NIPSS ADSC training for top level managers in Nigeria. NIPSS is National Institute for Policy and Strategic Studies. It is come in collaboration with African Development Center on a training for top level managers in Nigeria. The aim is to talk about strategic insights on planning to move Nigeria forward from where it is now to where it should be in the coming of nations. Guess who we have this time on this podcast? None other than Engineer Farouk Yusuf, who is Permanent Secretary of the Federal Ministry of Communications, Innovation and Digital Economy. Wow, very good one. The world has gone digital, so this man is speaking to how Nigeria will position itself in the digital landscape. Thank you for being with us on this podcast. It's great to have you here.
Thank you very much. Again, my name is Engineer Farouk Yusuf Yabo, the Permanent Secretary at the Federal Ministry of Communications, Innovations and Digital Economy. I would like to first of all start by appreciating NIPSS and ADSC for organizing this very important session combined with discussions and trainings. Life starts with planning, and there is a saying that failing to plan is actually planning to fail. So this is what strategy is all about. It's about getting yourself to know your purpose, to know where you are, to know where you're going, and how are you going to get there. Nigeria as a nation has undergone so many turbulent times. Today, we're even more challenged with so many issues, be it climate change, be it pandemics of the COVID-19, security issues, and of course the economy hasn't been too good, not just for Nigeria, but for the world at large. So if we look at all of this and the fact that our country is quite large relative to our neighbors and relative to our contemporaries around the world, it behoves on us as leaders to ensure that we plan and we define exactly what we want to achieve. And this is exactly what successive governments have been doing, particularly the current administration of His Excellency President Bola Ahmed Tinubu has run its campaign on the Renewed Hope agenda, which has 8 pillars. And these pillars ties down the entire Nigerian economy, but cutting across our socio-political and economic development. And my ministry, the Ministry of Communication, Innovation and Digital Economy, happens to be the key ministry that drives the entire economic transformation in the country, because when you talk about the fourth industrial revolution, you are talking about technology as a key driver of growth. And it cuts across all the sectors of the economy, be it education, healthcare, electricity, mining, and name it. The digital economy sector is to create that enabling environment that will allow for diversification into a knowledge-based economy, into a more or less an economy that is open to the world. And so as we speak, the ministry had developed a very clear strategic blueprint which speaks to how do we transform the economy into a digitally oriented one. And so the strategy has 5 pillars. First, we recognize that for you to transform, you need the people that can anchor it. We're not going to rely on foreign missionaries to do that for us. And so the number 1 pillar is knowledge. And we, under this pillar, intends to train 3 million technical talents by the year 2027. And that is to allow us to run the economy both as citizens and as public officials, and as well to be a net exporter of talents. The second key pillar of the strategy is policy. creating the right legal and regulatory frameworks that will allow for private sector to strive, allow for partnerships in different forms and shapes. So currently we're working to either review or develop at least 9 new policies, starting with artificial intelligence policy, blockchain policy, startup policy, and a lot of other ones that are going on right now. Recently, the AI, artificial intelligence policy was crafted. We're at the final stage of publishing it. The third pillar in the discussion of the of the digital economy sector is the infrastructure. The foundation for all communication is the connectivity infrastructure, which could be fiber optics, could be the satellites, could be any other infrastructure, of course complemented by other infrastructure like energy. So as we speak, the Federal Executive Council had recently approved for an SPV to be formed to build 90,000 kilometers of fiber optic across the nook and corners of the country. That to form the national backbone to complement the existing one. Currently, we have about 35,000 kilometers of fiber. And when we build the 90,000 kilometers, that will take us to about 125,000.
I said there's a lot that your ministry is doing, but let's touch on some of the pillars that you mentioned. You mentioned that there are strategies to achieve digital economic growth for Nigeria, and one of them is the people knowledge. Coming to that, it seems like when you talk about digital economy, you talk about tech, you're referring to those in urban centers. What is a strategy to include those in rural areas?
Yes, so like I've said, normally it's all about your people. You must be citizen-centric if you are going to succeed, because even when you have the technology and your people are not able to use it, you have not started. So as we speak, we already have close to 3,000 digital hubs all across the country that were built by the ministry and its agencies. And the whole idea is to get to the nook and crannies of this country to train young Nigerians. Of course, as you know, Nigeria is one of those countries that over 70% of our population is under the age of 40 years. And that's the age that you need to. So recognizing the real potentials and the needs, we have already gone far in developing most of these hubs. Of course, there are a lot of challenges in terms of sustainability of some of these projects. And right now, we, together with His Excellency, the Honorable Minister of Communication, Innovation and Economy, Dr. Bosin Tijani, are working very hard to make sure that these structures are put to best use, so that in all the local government areas of the country, you will have connectivity, and you have these hubs where young Nigerians can have equal access with those counterparts in the US and in Europe and in Asia, because the internet is all over, and we are making sure we get them to work. And this brings us back to the training we're having today, because without having a plan, without understanding the purpose for which government is established, and without having to set a clear blueprint, you will not be able to achieve your set objectives. So I think what NIPSS and ADSC are doing is clearly the most complementary thing to do at this time in terms of getting leaders to understand how best to craft policies and strategies in these turbulent times we're in. That, of course, I've mentioned so many things are happening that are beyond our control. And indeed, we are on the same market with the US, with South Africa, with Egypt, with all other countries. So it's important that we have a plan and we follow through in that way. Yes.
All right, so I know during the training, I think there was a conversation that had to do with long-term goal and short-term goal. So you mentioned that training 3,000 or 3 million people. Okay, so and you are looking at 2027?
Yes.
Okay, so are there plans to take it beyond this period? Because you get to see that you have people do vocational trainings and all sorts. There's a time frame, and after that, I mean, the appointment is just call it, I mean, they are done with it. So are there long-term goals put together, you know, so we can have continuity after that?
So, I mean, we are at the verge of a new paradigm, if you like, where the economic development is no more going to be relying on the conventional or the traditional isolated or silo engagements. So what we need today is to get our citizens, especially the young ones, to be trained in such a way that they can compete within the wider global market. So in the short, medium, and long, short term is to have short-term technical trainings, but our curriculums in the primary schools, in the secondary schools, and in the university must all have to change to reflect the new needs and demands. And so this effort is being done in a collaborative way. You may be aware already ministries like the Federal Ministry of Education are already working on technical tools for learning management systems where people can learn at the comfort of their homes and offices, because clearly we may not be able to train all the people we need to train using the conventional classroom teaching. So the same thing with healthcare. You may be aware that also the Ministry of Health is working on e-health tools. So all these long-term visionary issues that will make our country to actually compete with our contemporaries around the world.
Okay, so your ministry actually have a lot put together: communication, innovation, and digital economy. At the moment, let's look at that digital space, having to do with dollar and all of that. You want to do business outside the country, it's quite difficult because of dollar rate and all of that, the foreign exchange. So what is your ministry doing to ensure that business in that area, it's favorable for those that operate?
So as we are evolving, the biggest challenge that the digital economy as a whole is going to face is that of trust. Your ability to trust the systems that you are working on. That is the basis upon which you can have collaborative trading both internally and externally. And so one of the things that we are doing is to define the kind of infrastructure we need, the kind of security of such infrastructure, and we've just agreed or decided that we are going for DPI, establishment of a digital public infrastructure, which is simply ensuring that we lay the foundation of our identity system. We also lay the foundation of our national interbank exchange system, which luckily enough Nigeria is among the countries that have already established significantly the identity system through the NIPSS, through the NIPSS, which is a parastatal under the Ministry of Trade and Investment. Now, added to that, there is other data platforms like the NIMS, the passport. So all of this, the ministry is working to develop a data exchange where this infrastructure will be used to authenticate and create trust along all the players within the sector, so that around the world, people can engage with us and can be sure of identity of individuals that they are dealing with. And this is going to go beyond the identity of individuals. It's also going to be identity to properties. For instance, we are going to have to do our national addressing system, where all the houses in the country, be it developed and undeveloped, and including land, are going to be mapped out and clearly linked together, so that banking, credit, all this, if you like, control of our subsidies, control of our palliatives and whatever can be done with clarity, with minimal corruption and with clear transparency. That can only be done if our ministry is in a position to provide very clear ID system across the entire sector.
Do you see all of this happening very soon?
Absolutely. In fact, it's already done, because as we speak, currently the NIPSS of Nigeria has over 100 million identity already of Nigerians have been put together. And of course, you know, currently Nigeria has one of the most fastest interbank exchange. If you transfer money today, within seconds, it will get to your destination. Not even in Western Europe that you can have some of this advancement. So all we need to do today is to harmonize this and create the data exchanges that will allow for different other sectors. For instance, in public service, we are already trying to tie down all the public services that we're providing so that people can go online and get this service through a OneGov platform. As we speak now, the Federal Civil Service has already, working with Galaxy Backbone, developed what we call a OneGov Cloud. This is a public service portal where citizens can go in and get information and get services that they have.
Now that you've taken us there, let's go further. So this is the time for artificial intelligence, and it's what is actually reigning or trending in digital landscape. Yesterday, in the course of the training, there was a debate as to the dependency of Africa on the West. So, agreed that we have a lot of techie or individuals who are into the tech industry, creating apps and other things. But when it comes to artificial intelligence, where is Nigeria in that? In terms of machine learning, training of AI, how much have we done to ensure that we're not also depending on the West and trying to play catch up if we are to harness fully the digital economy?
Well, Nigeria has come a long way. For quite some time, there has been a lot of activities around the artificial intelligence space, but this has been done largely by the private sector. If you check, there are a lot of companies that are out of Lagos and other parts of the country that has become unicorn companies, meaning $1 billion worth of this. A lot of these companies also use artificial intelligence models to be able to run some of their businesses. Universities are also doing quite a lot, and even normal individuals in schools. But what has just happened recently is changing the entire paradigm. Government is stepping in. Government has invited over 120 global experts last 3 months back to come into Abuja and sit down together and craft one of the most ambitious artificial intelligence policy and strategy for the country. And these are all from Nigeria, of Nigerian descent, that have excelled in Harvard, Oxford, MIT, name it. And we have the draft already, like I mentioned earlier. So the starting point is for us to really define what kind of artificial intelligence engagements do we want, what kind of environment are we going to create. And the focus is artificial intelligence for development, for inclusivity, for growth, and for security. And right now, once this is approved, as we speak, we've also have commissioned in the ministry the initiation of our large language model development, which is going to be an AI model that is going to allow for localization, meaning that the 3 major languages of Nigeria and Fijian are the languages of driving this particular purpose. So we are positioning the country, laying the foundation and ensuring that we have a path that will take us to be competitive across the world without having to rely on any single nation or country. Of course, when you go around the world, you find Nigerians are top-notch in every university in the world, be it in Europe, in America, in Asia, Canada, and the rest. So I think the current leadership of the country, the president himself understands these issues thoroughly, and that's one new thing that is actually helping drive the discussion. The Honorable Minister of Communication, Innovation and Digital Economy, as you know, is a young man who has just come out of the tech ecosystem. He builds most of the iconic companies that are currently thriving in America, the unicorn company. So he was there, and the goal is for us to work and reinvent the entire economy through digital transformation.
If we had more time, we'll probably explore more and see what's actually happening in the Ministry of Communication, Innovations and Digital Economy. But we need to get back to the training which concludes today. And it's our hope that we'll get to see more of the strategic insights and planning knowledge that we've gotten from this training as it will come to bear in that ministry, and then Nigerians can begin to enjoy more benefits from the Ministry of Communications, Innovations and Digital Economy, as we've had the Permanent Secretary, Engineer Farouk, who has been here, Farouk Yusuf, who has been here with us on SOUQ podcast. Thank you so much for taking out time to speak to us.
Thank you very much. I have no doubt that the training we are going will impact in no small measure in changing things and in making us do our work much better. And thank you for having us.
All right, SOUQ podcast continues. We'll still bring you more participants, and of course, we'll get to bring to you now the facilitator of today's session. Before we get to talk with someone from ADSC, I'm sure you want to meet them. Don't worry, you get to meet all of them in the course of the show today. Do not go anywhere. The show continues. If you're just joining, it's still SOUQ podcast, and this is the grand finale on the special series that we began a few editions ago on the ongoing NIPSS and ADSC training for top-level managers in Nigeria. The theme is strategic insight and planning. So we have the honor of hosting on SOUQ podcast at this time the Director General, National Institute for Policy and Strategic Studies, Professor Ayo Omotayo. It's nice to have you on SOUQ podcast. Welcome.
Yeah, thanks for inviting me over.
I want to say that you're a man blessed amongst two ladies.
Indeed.
Thank you. And it's my pleasure sitting within two beautiful women.
Okay, thank you.
I like beautiful things. Yeah.
Who doesn't?
Yeah.
All right, so this training that's at the initiative of the National Institute for Policy and Strategic Studies, in collaboration with African Development Study Centers, providing strategic insight and planning course for top-level managers so they can upskill and be able to reposition Nigeria's public and private sector for a better Nigeria. This is a wonderful one because over the last few days, we've seen participants actually really enjoy the training. They've been interacting, sharing ideas, and so much intelligence has been in the room. And when you come in talking about how this is to also help them network, we'd like to understand why this training came on. I know it's for top-level managers, but what exactly informed the need for NIPSS to have this kind of training? The theme alone is so catchy: strategic insight and planning. Why not something else?
Wow, thank you very much. For us at NIPSS, our motto is towards a better Nigerian society. One of the things we have identified over time is that if Nigeria is going to get to where it ought to be, we have to improve on the capacity of our leaders and of our managers. The National Institute has space for only 96 senior executive course participants, where we engage with participants that have been nominated by nominating organizations to look at different problems that we have in our society. And of course, we found that if we are going to change Nigeria and we are going to have a rapid change, we need to give opportunities to other Nigerians that are in decision-making positions to be able to do so with the right skills. We take only 96 participants every year, and not everybody that needs the kind of engagements we give can afford to come to the Institute. So we said, let us begin to open our doors to trainings outside of the Institute on specific areas of capacity need for us to be able to achieve what we want to achieve. So this one is one of the very few we are doing outside of Kuru to address the issue of the gap and understanding of what strategy is. For most of the part, we come up with very good policies. But what fails us has always been lack of strategic capacities, especially by those who operate our system. So that is why we say, let us have this course on strategic insights and planning, so that beyond the right policies, we also will put in place the right strategy that will make for effective use or effective delivery of services through the policies that are put out there. And that explains why we are having this workshop.
All right, sir. Of course, the training is meant for top management, top level management. Yes, the decision makers. And again, I would always say that when there is an issue, we look at the leaders. You understand? We take it from the top. But at the same time, if you have the lower managers or those at the lower levels, if they are not well equipped, you can agree with me that that is also going to speak on or affect the work of the leaders. So what are we doing to ensure that even those at the lower levels are being carried along in a training like this?
Okay, that's a good one. We have addressed that in the past. We have some other short courses that we run at the Institute, and now we run some outside of the Institute where we address middle level leaders and managers of our bureaucracies. We believe that for every level there is a different need, and therefore what a child will need to eat is different from what an adult eats. So for top level managers, they have a need. We know what the gap is in knowledge, and we try to fill that, and we do so for the middle level too. What we have not done is for the much lower level, but we believe that there are a whole lot of other organizations and training institutions that can take care of that. But for us at NIPSS, we focus on those who have to take critical decisions concerning the growth and development of our countries. And then we also know that as those ones leave the stage, the middle level people come up. So we offer trainings and engagements for those categories too, so that by the time they take over, they are always poised to do the right thing when they have the opportunity.
We know that part of the mandate of NIPSS is to make data-driven recommendations to the executive, the legislature, so that policies that are necessary for Nigeria's growth will be made. Now, after this training, are there certain policies that you are looking at recommending based on what has been discussed, based on data that has come out in the course of this training that you think will help the country's growth?
Well, certainly we have case studies. But you cannot paint every scenario that will happen. So during the course, they will use case studies to understand how to approach problems and challenges, how to tease out things to do to solve certain problems as they arise. So for us, we give the framework. We give a framework, and we set the paradigms for the approach of solving problems, because you cannot paint all scenarios that will happen. But by the end of the training, they have sufficient skills to understand issues, to understand what the challenges are, and how to use what we call PESTO to tackle any problem.
All right, so you talked about capital development, citing Nasarawa as an example, the way it transformed. How can this be replicated, to cause societal change across states?
Yes, first, the leader is very important. That's why we try to start with leadership training for those at the very top. We've never had the opportunity of training governors as governors, but we have governors who have gone through NIPSS, and you can always see that they make a difference wherever they go. Everybody talks about Governor Zulum. He is an MNI, he is an alumnus of the institute, okay? But we believe that some of the things we do and some of those who come for our trainings come from the states, and we expect that those who have represented their states at the institute should be able to make the difference, reach their various governors, to let them understand the need for impactful capacity building for their staff. The governor of Nasarawa State, maybe perhaps because he lived in America for a long time, he came and worked at the top level at Dangote Industries before he became governor. Even though he is not an MNI, he recognizes the need for capacity development. We share common views that natural resources by itself cannot take any state anywhere. You need people, and you just don't need people. You need people that are vast, people that have the capacity to execute the functions of their offices. Nasarawa State is doing it. Some other states are doing it at some levels. Like I mentioned, the Borno State has been sending participants to us, but we believe that with time, other governors who are seeing the differences in the training NIPSS has been given and how it is impacting on other states will also come up and take advantage of the window that we are now, we call it state support services, that we're willing to support any state to develop the capacity of their staff.
You know that, as we are here now talking, some of the viewers are wondering, NIPSS, have I heard of them before? It's perhaps the first time that some people are getting to hear NIPSS, National Institute for Policy and Strategic Studies.
I like to say NIPSS.
Yes, NIPSS, yes.
NIPSS.
So, I know that the Institute, by its nature, likes to maintain a low profile. But do you think that more Nigerians need to be aware of NIPSS? More Nigerian organizations need to be aware and take advantage of the window, take advantage of the strategic training and even data that your institute has?
Let me take it from the last part. Yes, for data and for the reports that we have, we, after some assessment, we found out that most of the things that can actually help the Nigerian state, a lot of researches have been carried out. We have a whole lot of them lying in our archives. We have found that there is need for us to let people know that those things are there. But the first thing we need to do, NIPSS has existed for 45 years. Some of the data are in analog form. By the end of October, we should have concluded the digitalization of all of our records so that we can put them out there for people to access. Because it does not make any sense if they are sitting in our libraries, somebody is in Sokoto, and what he needs is in Kuru. We don't want people looking for what can easily be made available to them. So every of those records should be online. As per whether we have been very conservative, I believe NIPSS is a very conservative institute by nature. Because of what we do, we are thinkers and not entertainers. So we don't we don't have the necessity to broadcast the institute in the media. We believe our work should speak for us, and people are beginning to recognize that, yeah, there is a national institute somewhere where what we do is basically thinking and researching. We don't do teaching at NIPSS. We just engage with people. We expose them to how to gather facts and how to use those facts and turn them into forms of evidences, and then use those pieces of evidence to address policy issues that may arise. But as we open our doors now to engage with those who otherwise are unable to come to the National Institute, more and more people will get to know that there is a National Institute somewhere where they can access data, reports, and solutions to a whole lot of problems. It's going to take some time, but we'll get there. But just always remember that we are not entertainers. We don't have to be in your face.
Okay, so NIPSS is over 45 years now. So how often do you do change of policy to meet trends? Because, I mean, most times you hear people say, oh, government, it has been this way for all along. So how long do you do your policy change to meet the current trend?
Thank you very much. You see, in every government, their policies are different levels. So state governments will have their policies. Some local governments will have their policies. Big companies will have their policies. The ones that we face have always to do with the thinking of government at any point in time. We look at problems, and then we look at the policies, if policies are existing to solve the problems. If there are no policies, we try to develop new policies. If there are existing policies, we try to make a review of those policies by studying issues surrounding those policies. And as often as you may not know, government calls on us to ask that we reassess a particular policy and give our own advice to them. We do that a whole lot. The policies basically are for governments to make, and we attend to those ones. But then, because of the way it is, those things are not put in the newspaper. We work every day with governments. Currently there is a committee that is looking at all policies. We are doing policy harmonization across all sectors. It's been handled by Dr. Adiza Bala Usman. She is the leader of the Mr. President deliberately appointed her to look into it, and we are working with her. That will address, because there are some policies that actually archaic, some made several years back, some can no longer work because things have changed. So we are trying to look at all of those policies. Some will be recommended for total review, some will be thrown out, and the new ones may come out to replace the old one.
You just mentioned that there is a plan for policy harmonization.
Perhaps it's actually going on
also
right
take
now.
care of policy synergy, so that no agency or no policy of government is conflicting with another.
Yeah, we're doing that right now. In fact, we've gone very far. We meet every 2 weeks. Dr. Adiza Bala Usman is putting in a whole lot of efforts to ensure that we deliver on that assignment as soon as possible.
So once that is done, will it be in public domain so people know what policies have now been harmonized?
Yeah, we would advise government to make it public. Ours is to do the work and hand over to the government. But I'm sure the recommended changes will be transmitted to the various ministries and MDs, departments and agencies that need them. And it will reflect positively on the society when that is done. Mr. President is very concerned about a whole lot of things. He wants Nigeria to work. He knows that some policies are archaic, and that is why he set up the committee, and he's in a hurry to deliver. So all of us are scampering, working hard to ensure that we put something on his table as quickly as possible. Many people may not know it. We have a very intelligent president. He knows what he wants. But he cannot do the job by himself. So he gives out assignments, and then once those assignments are done, they're on his table, he's going to take his decision. And it's going to be for the good of everybody.
All right, thank you so much. The Director General of National Institute for Policy and Strategic Studies, Professor Ayo Omotayo, who's been a guest here at SOUQ Podcast. And SOUQ Podcast has been at the venue of the ongoing training for top-level managers put together by the National Institute for Policy and Strategic Studies. Thank you.
Thank you very much. Thank you,
SOUQ Podcast.
All right.
So now it's time for us to bring to you a doctor who has excelled in his field and is still excelling because it's still very much in service. This person is Professor John Okeniyi, who is the Chief Medical Director of Obafemi Awolowo University Teaching Hospital at Ileife. Thank you so much for being with us on SOUQ News Podcast.
Yeah.
He is a participant at the ongoing NIPSS and ADSC training for top-level managers, and he's a very intelligent one. If I was his lecturer, if I was his facilitator, I would say he's been a very intelligent student. Ask me why I say so. Because from the very first day that this training began, in fact, if you have been here physically, you see the energy in the room, you see the interaction, and you see the level at which these managers have been interacting, ideas coming in, and different people talking about how they're causing change in different spheres of life in their organization. Let's talk about your field. We know that this is a season where the country, not just Nigeria, the world is talking about the resurgence of monkeypox outbreak. And there's a lot that needs to be done in terms of community health. What exactly would you say is right with Nigeria's health sector that seems to be able to adequately attend to epidemics and some outbreaks? During the COVID-19 pandemic, the Western world were really expecting that Africa would be able to cope, would be able to survive, but the healthcare sector did it. They made Nigeria proud, they made Africa proud. Monkeypox, Ebola, Nigeria has been able to combat these diseases. What have we gotten right with community health? What have we gotten right within the health sector in spite of the brain drain and challenges? What needs to be done more?
Thank you. You've loaded that in. One, we're here for leadership training, and it's really to help us to rethink and have strategic thinking and to be able to be better managers of resources. So in a way, I can link that to what you have asked, because what we think is that Nigeria lacks adequate resources to take care of its health challenges. I am not one to think or subscribe to that. I think we need to just rejig the system and it will work just fine. Why do I say so? If we pay beyond lip service to the national structure, things should work. For example, recently we've talked about local government autonomy. The health system is failing because the primary health sector has failed. The secondary is failed, and in most places it has failed. Some places it's failing, like this Lagos state. And what we have left is the tertiary structure, and the tertiary structure is what we're now trying to do the work of three. So the federal government is encumbering itself in the wrong places. We have to take a pause and look back and say, okay, the local governments are supposed to be in charge of the primary health care. If we can just pause and redirect ourselves and activities, the country is not as big as we think it is. Less than 800 local governments. Let's start by leaving one Nigerian doctor and nurse in each local government and let that work for a year. And in another year, let's see how we can double the number and triple the number. But Let's build it from bottom up. What everybody sees is Nigeria is not working, and in Lagos you are focusing on loose. In Osun State we're focusing on OAUTHC, and that's not it. The focus should be at the grassroots. The Japa syndrome has denuded us of our health workers, so it puts a lot of strain more. But the Japa syndrome has also exposed us to reality. Our nurses, our doctors, our laboratory scientists are able to leave Nigeria and function in other climes that we all think are better than ours. So that means they must have been good. If they were bad, they could not function in that place. So we don't need external validation of who we are. We need to just believe in ourselves and then trust ourselves more and tweak things. So for me, for Japa syndrome, I believe as people are leaving, we have to invest in training more. Sooner or later, the outside market will saturate. The Indians did that. The Pakistanis did that. And at one point in time, people will come back. We have to therefore incentivize the nation as it is to allow those of us who are in the system to not want to leave further and to see what percentage of those who are outside will want to come. Coming back does not mean coming physically. You have children who are now Dutch, who are now German, who are now Australian. Those children are not you. And you have to think of your families and you don't want to come back home. But Nigerians can learn to give back by training. Let's harp on technology. So our schools can be better trained still. I believe we're very good. But when Nigerians are out of the country, they can also give back by joining the training first, by harping on technology to do that. To monkeypox, it's not going to be different than COVID or cholera. This past few months or weeks, we've been dealing with cholera. It's not because we've got water supply right or hygiene right, but there are some things we're doing right, very good, with public information on the radios, on the TV, on the social platform. Nigerians were probably more educated about COVID than most Americans, because during COVID, the NCDC was giving daily statistics and everybody was eager to follow it. We've reached the peak, now we're coming down. We're still peaking. So they could follow the trend. And that is where it's not just the healthcare workers are there, media, information, because in prevention, in preventive health, there's something we call primary prevention. Before the disease, enlighten people. Nigerians are not well enlightened, so we're not doing too good there. But in secondary prevention, that is, you don't want it to go too far, there we are doing excellently well. And it's to the hindworks of people like Olikoye Ekuti late, our former Minister of Health, Professor Lucas late, who was pioneer of primary health and preventive health, and he was number 2 in world health. And all of them, they had written books and they've translated themselves to our own generation of doctors. They are our great-grand teachers, and we still follow those principles. So those principles still work. We really need to be more preventive. For example, monkeypox now, you are talking about it. Everybody starts to talk about it. But sustainability, there's a disconnect. If we had held on to the lessons of COVID and continued with hand wash at every bank, when you touch the ATM machines and you clean, Nigerians got it right that time. The sanitizers, our engineers could quickly develop hand wash and put in front of every school, in front of every church. We could space ourselves in churches. People space themselves in the airports. They left each space, you sit here, this space is free there. We could social distance, right? And Nigerians got it right there. We're also lucky, just providence. The sun, by noon, the heat will destroy most viruses. So even when we're not doing things right, there seems to be one big guy up there. We call him God, we call him luck, some call him whoever. I respond to calling him God. He smiles on us and he looks beyond our limitations. So everything works for good. So I think we're in good track.
But I'll tell you, people still complain. You hear, oh, this is actually not right and this is not right. What is fundamentally wrong? And again, you know, sometimes you hear people complain about the hours of time they spend in hospitals, probably one nurse, one doctor attending to maybe 300 patients and all of that. Can you speak to me?
I had a tertiary care. My teaching hospital is the major provider of tertiary healthcare in Osun State. And we provide care to a major senatorial zone, which is the Ife-Ijesha community of Nigeria. You can't bring all of Nigeria's healthcare problems to one hospital and expect it to be solved. The wait time will be there. The burnout by the workers will be there. The funding of that one hospital, it's going to be criminal. So when we started this interview, I alluded to the fact that the healthcare structure in Nigeria is very good if we can just go back to the basics. It has a primary, a secondary, and a tertiary. Along that three-tier, we also have private, public sector. We have, how do we finance this? So there is health insurance. So if we look at these three things I've talked about, and then we rejig everything to align the three, it will work and it should work. The primary health care is supposed to be the closest to everybody. We have 774 local governments. Each local government should have primary centers where the person living in this place wants to deliver. She has a right to want to have a baby. She is pregnant, before she's pregnant or when to deliver. She goes there and have her antenatal care or prenatal care, or she's delivered, her postnatal care, vaccination of her baby there. Common injuries, household injuries, the child is playing football, braces his leg, that's where she should go, not loose, not the UCH.
I'm glad you
not
just
OATHC.
Let's take this, the Lagos example.
Yes.
So, Lagos State has many healthcare centers, which they are converting now to general hospitals. So, within a particular area, you can have like 2 general hospitals, decongesting what you may have, or decongesting that particular general hospital that served as the only general hospital in that place. It seems like there is a kind of thinking by patients or people who seek healthcare that if you go to a primary healthcare, you won't get adequate care. So they rather go to a general hospital. Could that also be the reason why, for mild issues, people would go to a tertiary hospital when that should be taking severe cases? If we adopt, or a state in Nigeria adopts the Lagos example by having general hospitals, healthcare centers in almost every part of the city with the help.
The Lagos model is a hybrid that may work for a while. A hybrid that I don't blame the managers for adopting, because the population of Lagos is massive and the area is small, so the concentration of people is even much more bloated. Lagos is like Mumbai, India, or London, too many people in a crowded space. So if the state is investing in doing its general hospitals, the state government is actually doing what it ought to do. The Lagos state government should have no business with the running of the local governments. The local governments should have primary healthcare centers. That is where vaccinations should occur. That is where teaching people about hand wash should be. That is where we teach people about management of diarrhea and prevention of diarrhea at home. Not the general hospital. The general hospital should be for secondary care. A woman who wants to deliver should deliver at the primary center. But if she has hypertension in pregnancy, she's going to have a twin, she needs this or that, she's having hyperemesis, vomiting too much, then she goes to the secondary care. The normal delivery has no business going to the general hospital. Should have no business. So we have to go back to developing the roots. And that's when people will have a feeling and connection with government and governors, where the roots are working well. And I told you, Nigeria is not as big as you think. 774. Let's start with 1 per local government, for heaven's sake. And then 2 in local government. And then per ward. That can work. And then the tertiary hospital should be for that woman who was infertile, didn't have a baby on time, maybe by IVF or by that big guy whom I call God. Now she's 60 and she's having her first pregnancy. That is not a normal pregnancy. She needs a specialist care. She should come to us. And she'll have a safe delivery. And when we are done and watching her for a while, we step her down to the general and they step her back to the primary care. We need not retain her for eternity there. So the congestion we are having at the tertiary level is because of abuse of the tertiary care system, is because of abdication from the secondary and primary, which is what we need to revisit.
So you were very involved in the class, like passionate, about some specific topic. Oh, okay. So you were very involved in class, like some key specific topic you were very passionate about it. What is that change? That one thing that is burning in your heart that you want to see it turn around in your field?
For example, I am a pediatric cardiologist and I run a tertiary hospital. Before I run this hospital, I had my field where I know that every Nigerian has a likelihood of needing those hospitals someday. In my field, we deliver a lot of children, but 8 out of every 1,000 live births will have congenital heart disease. And therefore, by the total number of births we have annually, between January 1st next year and December, expect another 80,000 Nigerian children to be born with congenital heart disease. How many of these will survive? Where will they survive? Where will they go and at what cost? It will happen. It's not, I'm not a soothsayer, I'm not a bad person.
How do you do the calculation? How do you
because
come up with that?
Because it's just known from research. 8 of every 1,000 deliveries, just data. Whether Nigerians, Ghanaians, Ugandans, whether US or Canadians or Japanese human beings, some of them will have some congenital anomalies, inborn errors, structural problems within their heart. Now, most will die because we don't pay attention to this. The few that will survive, at what cost? When we are not addressing it, it means those will be the people at the upper echelon, people whose parents have. So that child is going to die because his father does not have. And when they have, it's going to impoverish them because they're going to have to go to Israel or UK or India to get treated. There's a capital flight, which even if you and I don't have a child with congenital heart disease, the capital flight out of Nigeria is going to impoverish us because the money goes to develop India and their own health structure. So what I invested my life in is to learn the system. Yes, I learned on my own, but the government did start me up. But you need some pinch of patriotism to remain in Nigeria at all costs. I believe your grass can only be as green as you wet it. So we have to cultivate this country. We started our cardiac program. Our lead surgeon is Professor Uzoma Onwudinjo. So we're detribalized Nigerians, but we're in Ife. And what we do is we are now the leading center that does open heart surgical treatment of Nigerian children at a cost that it is the cheapest in the world. Our numbers are not the biggest numbers, but we have proven that it can happen. If you go to the Nigerian heartregistry.com, you can open and see if there's a live update of all the cardiac surgeries that are done in Nigeria. It is our center that is now the leading center for that. So I would wish the government to look into that kind of thing. Invest in such centers. We have tried. We have partnered with the SOUQ in Lagos and another private hospital, Tri-State in Lagos. So the three of us know that we're not man enough to get the accreditation. But we've collaborated, which is something we learned here again in this training. We've come together where 1 + 1 + 1 is not 3. We are now equal to 10. We're three different institutions. We are not man enough, but together we are man enough, and we are now providing this. My center is focused primarily on congenital heart disease, LASUT, the teaching hospital, is more focused on adult heart disease, where Dr. Falashe is. And we collaborate together now. We study together, we review cases together, and we're improving the numbers. That way, we are able to train Nigerians here. That way, we are able to treat Nigerian children. We are able to generate revenue and conserve revenue that would have been taken out in capital flight. We need government to help tweak that and replicate this system nationwide. We are also doing what we call cardiac missions, Nigerian-born mission, pro bono. We have a team run by Axon. Axon is Association of Cardiothoracic Surgeons. And they are now, we've instituted our own model in Udut in Sokoto. So they are now doing open heart surgeries in Sokoto too. And that same thing is helping them at UBTH in Benin. So they are also doing that. And they're doing that in Bangkok, a private institution. So we need more collaboration, more patriotism and focus. And we don't need external validation. I don't think we need other countries to validate us. They won't want us to grow. We have to agree enough is enough. We have to start.
Thank you so much, Professor John Okeniyi, for all that you have said on the podcast. And I want to commend your team for the work you're doing, because we know that it's very expensive. If anyone comes up with heart issues, whether it's heart disease or their heart has trouble, is an expensive ailment to deal with. And I imagine how some families, indigent families, would have been able to afford that for their babies, if not for what your team is doing. We do hope that, like you've asked, government support will come into it and replicate this, because it is needed in every part of the country.
Yes, I hope so too, and help us get the message out there.
And good that you said we do not need to seek the validation of other countries. It is for Nigerians, it is for Africans. So it should be Nigerians, it should be Africans to validate what is useful for Nigerians and Africans.
Yes, I agree with you fully. That's how I think. Yes.
Thank you again for being on SOUQ Podcast.
Thank you, and keep flying.
Thank you. The show continues in a bit. Stay. Yes, still on SOUQ Podcast. Each time we mentioned ADSC, Africa Development Studies Center, some are wondering who are the faces behind this firm that is committed to training leaders based on research and empowering leaders, so they are not just leaders, but they have the tools for leadership. We have here the country director for Africa Development Studies Center, Uzoma Onwudinjo. It's nice to finally bring you to sit here. Whenever we try to bring her and just interview, oh, I'm busy. Of course, she's very busy, because to sit in that office as country director, from what we've seen, is not easy. There's a lot that she handles. Finally, you are here. And ADSC has done it again, because from what we hear from the participants, they're so much impressed with this training. Like participants from other trainings that ADSC has facilitated have talked about, shared testimonials of how impactful the knowledge they've received have been. We just want to know why ADSC chose to partner with NIPSS for this training. Why the theme strategic insight and planning, and why are you so passionate about trainings?
Okay, thank you, Blessing. I mean, it's really exciting to be here. First of all, I'd like to say that for ADSC, I mean, our mantra is rethinking development in Africa. So it's development not just for Nigeria, but across Africa. You know, and I'd like to say that it's about time. We've always been looked at as people who are backwards and people who are not getting it right. So everybody says Nigeria is a developing nation. But the truth is that we can get it right. Nigeria has all the resources, we have the capacity, we have manpower, we have the skills that is required to be able to get it as a nation. But what we really need in Nigeria this time is basically strategy, the right strategy. Of course, having all of that in place and not being able to have the right strategy to be put it together, is a major gap. So basically, ADSC is privileged. I must use the word privileged, because for an organization like the NIPSS, of course, we know that the NIPSS is not just any kind of organization. It's an organization for, it's a strategic organization, or a tool by the Nigerian government. So for the ADSC to be privileged to have, I mean, the partnership with the National Institute, basically the whole idea is to be able to drive home the point. Of course, we know that the NIPSS basically does not have the doors open. Of course, the National Institute doesn't have its doors open to everyone. So they're literally strategic people who have to come on board, or decision makers at whatever sphere that are being brought on board. So this is just I'm looking for the words to call it. But the idea is to be able to give access to people who are not MNIs, but are in strategic decision-making positions or leadership positions, to be able to come together and look at the way forward for Nigeria. I mean, that's in a nutshell what this whole collaboration is all about.
All right, so I'm just going to ask you, Kaja, I'll put it all together. So what's the need for the training at a time like this? You know, then again, why training? Why not some other things? You know, we've attended a couple of trainings organized by ADSC, partnered with some other, organizations, and sometimes I see some other persons that have participated in the previous ones, see them show up again. What is that thing that is driving them, making them to, they just want to keep attending this training? I mean,
okay, so basically, let me start by boasting about ADSC a little.
Okay.
Let me start by boasting about ADSC a little. ADSC is not just any training firm or any training organization. For ADSC, we are very, very intentional about driving a change process. So we don't just conduct trainings or have people come on board and they just do all of the whole conference thing that goes all around, or the workshop thing that goes all around. But we're very, very deliberate about making that impact. So I can literally tell you that in time past, ADSC has been able to have programs or put up programs and training programs like this that has been very impactful. And I'm saying this because we are very, very intentional about M&Es. So for every time we have programs or trainings, we look beyond coming to sit down and having all of the sections that we have. We go into intentionally following up, intentionally monitoring and doing a lot of monitoring and evaluation to be sure that the right impact is created in these programs. So when you talk about putting up a program of this magnitude, strategic insights, of course, for top-level managers across the Federation, the idea is to be able to, like I said earlier, is to be able to look inward at what we have. We have the resources, we have the people, we have the manpower, we have everything that it takes to attain that global face as a country. But basically, we need to have the right strategy. So pulling in people of this group Of course, you see that the conference was, the training rather, was attended by leaders across MDAs, across organizations like that. The idea is to be able to bring them together, bring everyone come on board, and look at how we can re-strategize and move Nigeria to the next level. Like I said, it is possible. We just need to start by believing it. For each time we have meetings or we have sections like this, basically people are being taught about or being inducted, that's the word, into being the fourth runners of this change processes that we're trying to drive in Nigeria as a nation.
Okay, so I'll ask this again. Now it's for top managers, and I see that top level management and trainings, you have this over time, over and over. Is there a plan for the lower level managers or even just upcoming? Because I mean, there should be a place for the youth. You know, so any plan to come up with trainings like that for such
Okay, so basically ADSC caters for needs like that. Like I would say, the NIPSS is not an organization that is open to everyone. But of course, we understand that it is for strategic group of people who are basically at certain leadership positions. But of course, the ADSC has been very involved in doing a lot of trainings. You know, because we can't get anywhere without trainings. When people don't know what to do and they're not taught how to do it or taught what to do, then there's every indication that you keep getting it wrong. So until you go to a school, you are taught by the teacher, then you get an exams. But if you don't go through that process of learning and you're given an exam to write, so automatically we know that you're certainly going to fail that exam. So that's the process. So like I said, of course we have certain other programs that are running across the Federation. And the whole idea is to be able to drive this change through every single sector, in health, in IT, in education, in all this. Yes, exactly. It's cutting across every sector to ensure that at the end of the day, Nigeria, that's Nigeria, is born.
We have been talking with the country director for African Development Studies Center, Uzoma Onwudinjo. It's been a pleasure having you here.
Thank you, Blessing.
We'll let you go now. And it's a wrap on SOUQ Podcast, the special series on strategic insights and planning. From all we've been talking about, you may not have been a participant here at the NIPSS and ADSC training, but you perhaps have grabbed one or two useful strategy, one or two information that will help you in whatever you do. Remember, the goal is to reposition Nigeria in its rightful place amongst the community of nations. I am Blessing AJ. I've been doing this with.
And I am Grace Komolafe. Thank you. Bye.
Until the next edition of SOUQ Podcast, which you do not know where it would be, you don't know what the location will be, might be coming to your event, it might be from the studio. Be good and have yourself a great day.